Hi everyone, we're going to start in just a few moments, just to let people join us here on Zoom. So good morning, good afternoon, good evening, depending where you are. I'm Catarina Paz Duarte from the Earth Center. Welcome to the Networking Fridays. Today we have a special session on the Blue and Health initiative, and I'm very pleased to announce our first speaker, Paul Gadeia, the president of the Fiocruz strategy for the 2030 agenda. Paul, thank you, and the floor is yours.
Thanks a lot, Catarina. For me, it's really a pleasure to be here on the Network Fridays. And I always remember Moutinho, with whom we still have a very close cooperation, because every time I think on the Network Friday, I think of the work of Moutinho. What we'll do is a general introduction, and my colleagues and friends, Carla and Alexandre Turra, will go into more deep consideration in terms of Blue and Health. But it's important to place our institution, Fiocruz, to understand how we moved in terms of this theme of ocean and Blue and Health. Well, Fiocruz, as stands for Oswaldo Cruz Foundation, is an institution of the Brazilian Health Ministry. It has a very unique scope of activities because it has this very broad action in terms of the areas of health, in terms of research, in terms of human resources, production of vaccines, control of quality, many areas. And we always doing also what would be the connection with the most pressing contemporary issues, which has made our history that is now celebrating 125 years. We are a national institution, and we are present in 13 states with scientific units, but also we are present in all the states and regions of Brazil. Well, Fiocruz joined the Air Center, and now I'm the president of the board of directors. And this has to do with the recognition of the importance of Air Center and the importance of ocean as a theme that has straight connections with all the things we are doing on the health field. And especially for one of the reasons that also we chose to have as a main guidelines for our strategic development, which is the connect with the 2030 agenda. We already had for several years work related to the oceans, both in terms of our lab in the Antarctic area, but also in many other specific projects related to vulnerability of coastal areas, populations, the connection of ocean and disease, and so forth. But we thought that it would be very important, and this Earth Center helped us to have a very broad perspective. And we strive also to bring to the scope of Earth Center the question of health. And the best way we found to do this, not only in terms of Earth Center, but as a movement, bringing this idea and having it as a project of networking, and it's shaping the idea of Blue and Health that we'll develop a little later on. I will just share my presentation. Just as a guideline. I hope it's working. Are you seeing it?
Yes.
Okay. So what we always try to do is to think of these initiatives in a very systemic way, and the connections that we have in terms of synergies and possibilities of giving a more related and articulated work. And in this case, we are dealing with the planet crisis. We have several multilateral agreements. We mentioned the 2030 Agenda, the Paris Agreement, and the Sendai Network. But we have also the Biodiversity Convention and so forth. And with the idea that from our perspective is that the 2030 Agenda is the one who is most encompassing in the terms of connecting the dimensions of economy, society, and environment, and having goals that would qualify all these agendas in terms of important questions related to equity, related to many of the what would be the principles of the 2030 agendas and the SDGs. We have this characteristic of the 2030 agenda, a very important process that was joined by 193 countries, and it was a very important leap from the previous reference, which was the Millennium Goals, because it had these characteristics of being universal, indivisible, integrated, and aspirational in terms of its goals and its holistic nature. We know that we are lagging far behind in terms of the SDGs, and we know that we won't be able to achieve the goals on the 2030 goal. But what is important is that we have the possibility of working with these aspirational values of the 2030 Agenda. We have tools to think of the connection of these different goals, and we have many important works that have been done trying to face the challenges with a lot of experience that should be used during the time of the 2030 Agenda and the post-2030 Agenda. There are a lot of works now dealing with the prospection of 2050 and discussion in terms of how the future will bring these challenges and how we will be facing them. Well, this is something that everybody is aware that we have a very critical moment in which the limits of the planetary system, the boundaries are being broken, and it is important also to think that besides the classical definition of a planetary boundaries, we are now working also with the boundaries in terms of justice, and in terms of the limits of the resilience of the planet, and in terms of justice, we are looking at the effects on people and the possibilities of resilience of the planet and the populations, both the animals, the biodiversity, and men. And we will have a very important challenge with the COP30 in Brazil. The last forum were very timid and I would say didn't meet the expectations. We had the G20 in Brazil, which advanced in many questions. And in the case of Brazil, it was important to bring the theme of inequality. Other themes were very important, like bioeconomy, the question of the protection of forests and so forth. In the area of health, the ministerial declaration adopted the proposal of Brazil to have not only the question of climate, but the One Health approach. But the final declaration was very timid in terms of climate, and especially in terms of climate and health. Baku also was very frustrating, and we had a very short. I would say it was in many ways a regression what the expectations of Dubai, and the financing was a point that lagged behind in terms of what is needed to advance in terms of the climate change challenge. And we will have also the biodiversity COP, the COP 16 also was not very powerful in this area. And we'll have this big challenge in Brazil, especially now with the new Trump government getting out of the UNFCCC, and we are having this challenge to not only make sure that what it was decided will be implemented, but also the fact that we need to have a movement to counteract in terms of the regression that the Trump government represents and many other global initiatives in terms of sustainability. Well, the global health and the 2030 agenda has some very important priorities. I am just bringing here the question of catastrophic events, the climate and health, and One Health. The One Health concept, we'll leave this to Carla and to develop more, but it's very important that it's very much connected with this idea of the challenge of complex systems and the connection of these two main areas of human-animal ecosystem health. And we have some important figures in terms of the health threats, in which 75% of all new infectious disease originate in animals. There was zoonotic disease that break the barrier, and so forth. It's also a catalyst of sustainable development, but as in other systemic and complex approach, it has some challenges in terms of not only the importance of bringing a big frame, and but also it's all this trying to bring together disconnected systems, but also we have to make sure that we don't have this only in terms of stand in terms of bringing interface and complex systems as a starting point, but not but having operational, having the possibility of technologies and policies that represent the effect of these approaches in terms of changing things. So we cannot be too narrow in terms of fragmenting these processes and losing the connections, but also not being too general, so you don't have tools that will make the synergies operational. And also the fact that the Design One Health programs will involve all stakeholders in many different directions. The connection of ocean health, you are more aware, and also Carla will detail this much more, so I will go forward. Again, the blue and health, the idea, and in our case from Fiocruz, it was very important to bring the question of empowering society. And in this, we always trying to bring the social, environmental, and anthropological approach in terms of thinking on the vulnerability, the populations which have vulnerable conditions, And in the case of the oceans, we'll see that we've been developing many programs and trying to bring the population agency in terms of the shaping of the projects, in terms of acting as agents not only in the production of knowledge, but also in terms of the policies that should be developed. Well, Fiocruz, as I said before, chose the 2030 agenda as one of the main references, and for this, established the Fiocruz strategy for 2030 agenda. And this has been one of the main framework that we have in terms of developing our programs and projects. And as part of this, we also developed a strategy for climate and health. I won't go into details, but it's very important because this became the most relevant question in terms of public health, of course, the most relevant question in terms of the future of the planet. And we have many different connections of the challenge of climate and health with the ocean. And we are doing important initiatives in this area of climate health. We'll establish a climate and health center in Rondônia. We'll have also the same approach of trying to address complex and disconnected systems. We'll create, we are creating already a center for a synthesis center on climate change, biodiversity, and pollution, and of course the Blue and Health program. In terms of the role of Fiocruz in the ocean, I mentioned our participation in the Air Center. Ocean is, well, Fiocruz wants to really go deep into this in this area, and we have many already important initiatives that we'd like afterwards to share with this network that's so important in terms of the Air Center. I will just bring attention to this. When I mentioned the question of social biodiversity vulnerabilities, we have, for instance, the Marangatu network that is anchored in the Bocaina project of the Fiocruz and the traditional communities in a vast area in the southeast area of Brazil. And this is a network that has Brazil, Chile, and other countries in terms of in terms of the local population and that live in the activities on the ocean, in connecting to work and make a process for resilience and adaptation in terms of the question of the oceans in many different dimensions. And one of the things that is very important, again, as I said, is to integrate the traditional and scientific knowledge. Turra is here. We have a very close cooperation, the UNESCO Share for Ocean Sustainability. I mentioned before the Antarctic lab, and we are now also having a close cooperation with the National Institute of Ocean in Brazil, the INPO, and also with the Ocean Quest in terms of the deep oceans and initiatives that we are trying to connect with what we are doing in terms of health, in terms of bioprospecting the oceans and so forth. Well, this is just a phrase by Guterres to say that we crossed the boundaries, and we have a huge challenge. And I thank you very much for making possible in sharing this this possibility of connecting Fiocruz, One Health, Blue Health, as an important aspect of the ocean community work and challenges. Thanks a lot.
Thank you, Paulo. Thank you very much. Our next presenter is Carla de Freitas Campos. She's public health technologist at Osvaldo Cruz Foundation, president of the One Health Commission at the Regional Council of Veterinary Medicine of Rio de Janeiro. She also a deputy coordinator of the Transnational Research Program in One Health, coordinating actions and projects focusing on caring for animals in vulnerable conditions. She's coordinator of the Blue One Health initiative under the Fiocruz strategy for the 2030 agenda and deputy director of the Institute of Science and Technology in Biomodels. Carla, please, the floor is yours.
Thank you, Catarina. Good morning, good afternoon, good evening, everyone. Thanks for the invitation, for being with you today. I'm very happy for being here. I'm going to share my screen. Please let me know if you can see it properly.
We can.
Okay, thank you. Then I'm going to talk to speak about Blue One Health, because we have only one ocean, one planet, and one health. And thanks for the opportunity for being here. Paulo talked about, mentioned Osvaldo Cruz Foundation. We are a large public health institution based in Brazil under the Ministry of Health. It's aimed to generate, disseminate, and share knowledge and technologies aimed to strengthening and consolidating our unified health system and contributing to the promotion of health and quality of life for the Brazilian population, reducing the social inequalities and the national dynamics of innovation with the defense of the rights to health and broad citizenship as core values. As I mentioned before, our institution is very dedicated to the social issues in Brazil, to reducing them. And according to the World Health Organization, health is a state of complete, I'm going to change this, a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's very important for us to have it in mind. As Paulo mentioned, also, Fiocruz is present in the whole country, but we do have infrastructure or facilities in 13 states in Brazil, and many areas of action. I'd like to highlight a few of our initiatives. We always consider the social and environmental determinants of health, as I mentioned, and also working on the nexus of climate, sustainability, health, and environment, and especially dedicated to the ocean in this initiative that we are talking about today. And we consider that the local community-based initiatives are very important, and we've worked on that since the foundation of the institution. We have I'd like to mention our translational research program on One Health. We've mapped the researchers in Fiocruz that work on this strategy, which were 106 ones when we mapped. We are going to do it again in a few weeks. And 65 research groups. As Gadelia mentioned, we have the Fiocruz strategy for the 2030 agent, which is very close to the One Health strategy, and the Bocaina Observatory, the Marangatu Network, and the K4P Alliance that we are part of it. This video that you can see in the bottom, you can see those dogs that are very thin and with skin lesions. They all belong to indigenous people here in Rio de Janeiro. And we are starting a project dedicated to animal health and also investigate human health and environmental health. I'd like to bring it to you as an example of the activities that we do in the One Health approach. So the main drivers for infectious diseases in humans are linked to the human activities that make us more prone to contract animal diseases, also worsen health conditions and negatively impact the environment and animals' health as well. So we have a growing demand for animal protein, and if we keep the things that we are doing, like the things we are doing nowadays that we've historically done, we are gonna need the double of the amount of an animal protein that we need nowadays by 2050. So it's very concerning because it's not sustainable currently, and then how we are going to do it if we have to double, and especially we have to feed, we will have to feed around 10 billion people by 2050. So it's very concerning. We have a non-sustainable intensification of agriculture, the land use change, climate change, as you know, and this population increase that it's gonna happen. And we still have poverty and social inequalities, which pretty much worsen all the issues that we have. The human-animal interactions that are gonna be closer and more common as we change the land use, and the climate is also changing. And we also have the changes in ecosystems and war and hunger. So these drivers are also
Carla? I think we lost you.
Yeah, seems she lost her connection.
Yes, just wait.
Let's wait for.
Let's wait just a second, see if she can return. Sorry about that. We're just going to wait just a minute to see if Carla can join us again.
I'm so sorry.
It happens. Fine.
Yeah. So I'm not sure when it stopped.
Just try to share again, then we can tell you.
When did it stop for you?
Can you share the screen and run some slides and run the slides, then we can tell you when it's stopped.
I have to do it all again. When did it stop for you?
So next. Well,
Yes.
Probably this one. Sorry, the previous.
Yes, this one.
Okay, I'm sorry for that. So we have the main drivers for diseases in humans. The human activities make us more likely to contract animal disease, also worsen health conditions for us and for them, and also for the environment. And we have a growing demand for animal proteins, which is probably gonna double by 2050, which is very concerning. Especially because we already have a non-sustainable intensification of agriculture, and how we are going to do it to have more protein being produced, but doing it in a sustainable way. We need a lot of change. We are having a land use change, which is very connected to the other problems, and the climate change and population increase. So by 2050, we are probably going to have around 10 billion people living in this world, and we still have poverty and social inequalities issues. And human-animal interactions are going to be even more common, which makes us more prone to contract diseases and also for them to contract disease from us, which also leads to changes in ecosystems. And hunger is an important driver of disease. So if someone is in poverty, is suffering, it's not a matter of empathy, it's also a matter of health for all of us. Some numbers that show how connected we are the 60% of infectious disease in humans that came originally from animals. And it's a very expressive number. And we also have, as Gadelia mentioned before, 75% of emerging and re-emerging infectious disease in humans came from animals. And this number is going to increase as the climate change is going on. We also know that 5 new human diseases appear every year, and 3 of them are of animal origin. And around 8% of all agents with potential use as a biohazards also have animal origins. So those numbers show us a bit about the relevance of working on the One Health approach. And we also consider that health must be in all areas of policy. So it's one of the reasons why we are here today. We know that population health is not a product of only the health sector problems. So it's also driven by policies outside the sector. That's why we need the health in all areas of policy. And every sector of the government has the potential to affect the health. It includes the infrastructure, social aspects, food production, peace, and economic development, and so on. So we are facing the climate change crisis. It has results on the health risk, as we mentioned before. So we have the hazards that are related to the climate, extreme weather events, heat, sea level rise, air pollution. Then it changes the vector distribution and ecology. We are seeing nowadays this infectious disease that didn't occur in some countries, like dengue in Paris, for example, in France, which was traditionally only tropical, water scarcity, reduced food production, and the vulnerability factors are related to those hazards. And we also have the exposure to animals, to the environment, to the people, and to the infrastructure, and many health outcomes from the beginning with the injury and mortality from the extreme weather events to the mental and psychological health issues. There are so many that we need to have the climate change issue on our research, or most of them at least. Then we have those risks that are shared by humans, animals, environments, and the ecosystems. For those reasons, there is a current global recognition of the need for integrated, holistic, collaborative approach, especially following the COVID-19 pandemic, because it's probably a zoonotic disease. That's why the One Health approach is being advocated so strongly, so commonly, but it's not a new approach, it's not a new concept, it's been there for many, many years. Since during the COVID-19 pandemic, it's the One Health high-level experts panel was founded, and this definition is from the panel. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. But there are many, many different definitions of One Health. This one is the most commonly accepted nowadays. And the One Health approach requires multiple sectors and disciplines to work together. And also we need to involve the society in different levels and promote human and animal well-being, addressing water, food, energy, and air needs. Also addressing the climate crisis and sustainable development. So, as Gadelia mentioned before, it's not easy. It's very complex to have an approach holistic like this, but we need to work together to have effective results. And this is another a paper stating about the need for translating the One Health approach in action, which is not easy. A bit about the changing in light, changing in land use, and the proximity that we have with the wild animals, and then the microbes may jump from one species to other, from the animals, that wild animals that are close to us in some areas, or we are close to them, and then we can have the microbes from the people to other animals, domestic animals, and to other people. And then, since we live in a globalized world, it may spread quickly between people, and then it generates a pandemic. So talking about the blue One Health starting, we know that we live in a blue planet. The ocean covers more than 70% of Earth's surface, contains more than 94% of the world's wildlife. I apologize because I'm a veterinarian and I'm probably talking to ocean science people, and you know it much better than I do, but I'd like to mention anyway.
Eu entendi agora o que aconteceu, e aí eu depois falei.
The ocean holds more than 97% of the planet's water. It's a carbon sink, as we know, and regulates climate at a global scale, which is pretty much important, not only for our health, but for food production. Then we have more than 3.3 billion people around the world who depend on the food source from the ocean. But also, since the ocean stabilizes the climate, we need it for a healthy ocean for food production in land as well. And as you know, it's also an economic tool, providing jobs, livelihoods, and transportation, and from recreation to medicines, we all depend on the ocean. And we need to have in mind that it has no borders or limits. Then we require, especially for the ocean, we require integrated local, regional, national, and global cooperation to have better results. Then we propose the Blue One Health approach. We actually consider it a tool that recognizes the interdependence between ocean health and the health of humans, animals, plants, and other life forms, as well as the environment and ecosystems, whether distant, nearby, or beneath the water surface, aiming for effective outcomes for the health of all of us. It's a part of the One Health strategy, so we are not creating a silo or a box, but we understand that it's a tool to emphasize the need for inclusion of the ocean in the health-environment relationship. We understand that it's a chance for us to address a historical and recurring harmful exclusion of it, because it has an essential role and the marine ecosystem as well in the health and life on Earth, especially in the light of ongoing climate and environmental changes. That's why we propose it. Gadelia mentioned before some of our partnerships, which are very much important. We have two with us from the UNESCO Chair for Ocean Sustainability, but we do have other partners and some activities in our institutions that are also connected to this, like the 2030 agenda. We connect to the Ocean Science Decade. Also, we work on the One Health Joint Plan of Action. The One Health High-Level Experts Panel created some documents that are reference documents for the countries. So the United States just released, I think, last month, if I'm not wrong, its joint plan of action, its national plan. Well, Brazil is working on its national plan as well. I'd like to mention the decision on biodiversity and health adopted by the Conference of the Parties on the COP16 in Colombia last year, which mentions I'm going to show you later, which mentions the need for working on the One Health approach for the biodiversity. And some core objectives for the Blue One Health that we consider is to promote it by sharing knowledge and providing tools to support the transition towards ocean and planetary sustainability, aligned with the national and international ocean agendas, establish technical cooperation and scientific diplomacy, implement it, especially in riverine, coastal, and inland communities, as I will also mention, because we understand that those peoples are sentinels for the ocean health. Encourage funding programs, because we all need funding for our projects and programs. Empower society and preserve nature, considering that we are in an interconnected world. So we also understand that this approach must be social, environmental, and anthropological. Also raise public awareness of the interdependence between human, animal, and environmental health, emphasizing the ocean health. So it's a change in the way we relate to the ocean that we propose. Promote the integration of the ocean in the One Health activities and the One Health Joint Action Plan of the countries. That's a suggestion. And support the actions under 2000 agenda, especially the Sustainable Development Goal 14 of life in the water, of course, and the Decade of Ocean Science in general, but especially the Challenge 10, because we understand it's a way that we can work on to make the society understand how important the ocean is for all of us and change the way we relate with it. So some key themes that we suggest are air, water, and soil pollution, and human, animal, ecosystem, and environmental health, the connection between them. Information, communication, and education for all levels of society, and including it in the approach, and involving economy and culture. And we need to work on environmental preservation and restoration. And for that, we need to work on the diplomacy, advocacy that we are doing here today, and also talking with politicians to work on legislation and integration of the policies, and also work on the vulnerability issues, social ones, economic, and environmental. It's also well known that the issues related to One Health are also related to the ocean, as you can see in the picture here. Then it's clear for us that from the most basic needs, breathing, hydration, nutrition, and shelter, all health and life on Earth depend on the ocean, no matter we are far or near of it. So we really need the society to understand and make it a routine for them. Some points that we understand that we need to approach also are that the SDG 14 is still the most underfunded, unfortunately. Also, if we talk about the One Health, the ocean is not mentioned or considered as often as we understand that it should. So I've attached this pretty screen so you can see from 4,886 scientific papers. Only 24 of them mention at least one of the expressions related to the ocean. So we need more funding, we need more connectivity, more researchers connecting One Health and the ocean, especially because the ocean may both affect, it does affect actually, and also flattens human activities and health. And another point is that we must be careful for not having a One Health approach that is anthropocentric. It's not supposed to be. And these are some key facts that I've already mentioned. So there are so many examples that we need to work on the One Health approach. So as I mentioned before, we think that we support especially the challenge 10 of the ocean decades to restore society's relationship with the ocean, but also we can improve skills, knowledge, and technology with the participation of all and understanding the relevance of the Blue One Health approach. And then for the Sustainable Development Goals, the One Health approach is very connected to the SDGs in general, but for the Blue One Health, especially life below the water and good health and so on. As a mission, we understand that the Blue One Health should defend the rights to health as a core value, promoting awareness of the importance of the ocean in sustaining health and life on Earth. So it should be a driving force to engage professionals, decision makers, policy makers, and society, so we can have better results. And then an important point that I think is that we need to change not only the way we work, but especially the way we relate to others, no matter if it's from our species or other species, and also from the environments near or far. So I like to say that One Health is much more than empathy. It shows that we all are connected and interdependent. Just a little bit about the decision adopted by the Conference of the Parties in the COP16 in November. It's a long document, and the One Health approach is almost the base of it to connect biodiversity and health. I'd like to mention that the OLEP, the high-level experts panel, they have published this inventory of One Health tools and resources that we can use to connect with the One Health, with the ocean science researchers and make this interconnection easier. We understand that we need policy development and advocacy, capacity building, and integrated surveillance and early warning. It's in general for the One Health, but also for the Blue One Health. We need the research and knowledge sharing and governance, and especially collaboration. As a holistic approach, we need to collaborate, we need to integrate, and we'd like to institutionalize multi-sectoral governance structures for integrated decision-making, and strengthen collaboration with international organizations. And again, thanks for being here, for having the chance for being with you today. And we are working on a project to establish a Brazilian Virtual One Health Institute and associated network of collaborators from partner institutions. And then we propose the Blue One Health approach to use the One Health tools, the 2030 Sustainable Development Goals to support the ocean decade challenges, and use the knowledge from the oceans and marine sciences in order to support the climate stabilization, all the ecosystem services from the ocean, the climate stabilization, air quality, and food security, and water security, in order to have healthy people, healthy ecosystems, healthy animals, healthy environments, and especially a ocean. Then, as I mentioned, it's a paradigm shift. More than a change in the way we work, we need a change in the way we live and relate to others. So if there is someone covered, it's everybody's problem, not from the other that person, and the same for the environment and for the animals if they are in need. We all need to work on it. Thank you.
Thank you, Carla. Thank you very much for the great presentation. Before we go to the Q&A, I would like to invite Alexander Tura, professor at the Oceanographic Institute of the University of São Paulo and coordinator of the UNESCO Chair for Ocean Sustainability, a biologist with a master and a PhD degree in ecology from the University Estadual de Campinas, it's easier in Portuguese, that has developed activities focusing on interdisciplinary and integrated research, mainly on topics such as governance, integrated management, and marine conservation, and also marine and environmental impact, climate change, marine pollution, and marine biodiversity. Alexander, the floor is yours.
Thank you very much, Catarina. Thank you, Paulo and Carla, for this amazing introduction and comprehensive approach of the team, considering the importance, the strategic importance of talking about Blue and Health in the context of One Health. So it's not to create a silos, but to emphasize the importance of to shed light into the ocean in this system. I would like to echo the acknowledgement to José Moutinho, a dear friend that was pushing for this idea, for this concept and this strategy. I will be very brief, only to emphasize the importance to understand the Earth system, how it's structured and how it works. We are talking about biogeochemical cycles. We are talking about processes in different temporal and spatial scales, including the teleconnections that make us have processes or phenomena being influenced from very distant locations, such as El Niño, the influence of El Niño in Brazil, and the importance of Antarctica in the South Atlantic. So only two examples. And in fact, we need to consider when we talk about Blue and Health that it not only brings a framework to act, but also a philosophical framework to think about what would be possible futures that we may build. This is set by the IPBES, the Intergovernmental Platform on Biodiversity and Ecosystem Services, and it's called Nature Futures, in plural, frameworks. And this considers different aspects related to the relationship between us and nature. And we have basically three types of relationships. One, based on intrinsic values of nature, then we need to consider nature for nature, its intrinsic values, the philosophical understanding that we are not necessarily the center of things, of decisions, and we need to recognize our role as a plague, as a species. That increased a lot in number. The other aspect is to consider nature as culture and the integration between us and nature, considering relational values. But we also need to consider, and it's important that you capture that in the idea of Blue and Health, the nature for society, which considers instrumental values, so the benefits of nature to people, the ecosystem services, and so on. And this is highly important because when we are considering more anthropocentric view or less anthropocentric view, we need to understand that the system is complex, is dynamic, and it has to have vitality or health. And then this comes to the necessity to define health and how we measure it. Paulo brought the idea of the planetary boundaries, which are 9, which can be used to identify if we are close to the tipping points that will change the way the ecosystems work and will have tremendous impact on our lives. But we may also think about the idea brought by Ben Halpern and collaborators, and the idea of ocean health, or the Ocean Health Index, that incorporate 2 aspects: the quality of the environment and also the possibility of this environment to be used. So when we combine both and we have the best of this combination, this would be a good definition, could be a good definition of ocean health. And this is really important because this also relates to the necessity, as Carla said, to restore the society's relationship with the ocean in different aspects. And one of these aspects is based on the co-construction processes of this relationship, of this understanding, and of the futures. So in the end, I would like to emphasize that even in Brazil, we are pushing strongly for this pathway, and understanding that we have copy 30 in Amazon, and we need to remember that we have the green Amazon and the blue Amazon, and they are connected. So we need to use different types of approaches and strategies to emphasize the importance to consider an interacting system, so that we can, when we understand, we can move forward. And to finalize, I would like to reinforce the importance of building capacity, and supporting research. That's why Fiocruz, that's why FAPESP, the São Paulo Research Council, São Paulo State Research Council, are so focused on supporting this type of approach, understanding who is working with Blue One Health, and create opportunities to build capacity and expand this approach, so that we can influence the processes, the global processes, like COP of biodiversity, COP of climate, the G20 process, the United Nations Ocean Conference, and as well as the Ocean Decade and its outcomes and legacy after 2030. So we have a good opportunity to reinforce the role of the ocean in this planetary system, to promote planetary health, planetary homeostasis, and in a way it will benefit everybody, not only specific groups or specific sectors. So this would be my message, and hope you can have time. We will have time for Q&As. Thank you.
Thank you, Alexander, for the message. We have a few questions. We'll try to address them. First questions from Natalia Spin Alvarez is for Paulo. How can international partnerships within the Atlantic community enhance the adoption of Blue One Health initiatives?
Well, in many ways, actually, in terms of the bilateral agreement, for instance, Fiocruz is now ready to sign with their center an agreement on Blue One Health. And this, the idea is this will be presented in the summit of Portugal and Brazil, which will occur now in February. But we have many instances in terms of the Atlantic Basin, I would say even more than that in terms of global, because the reference of One Health is, as I try to show, a main reference nowadays in terms of not only the WHO, the UN, the G20. And so when we have this approach, and we make it connected with the ocean, we open and a really important possibilities of corporations that people sort of become aware that think in terms of the synergies. Will explain much better what are the challenges of the ocean, and also bring us a sense of emergency because when we are talking about health, this has a very great impact in people's populations and society. So that this question, for instance, I will just I won't have time to just go much more deeply on this question. But when we were talking about climate and climate health, the main question that we had, besides recognize that climate is a sanitary crisis, is the fact that health brings this sense and the connection and the possibility of awareness of people, because it impacts very deeply in their lives. And when I'm talking about their lives, the conscious that their life and the life of the planet also. So these dimensions of human, animal, and ecosystems. But I think you have a very good question. And from what we are receiving, reactions from different international institutions, funding agents, and so forth, the response has been very promising in terms of adopting the reference of Blue One Health.
Thank you, Paul. The next question is from Balrinwa Balogun. He's the director of their center in Nigeria. The question is, I wonder if there is an ongoing project or one being planned that could engage all the interested countries in the Atlantic Basin to contribute from their national experience to the Blue One Health questions.
May I add just this, Catarina, then we'll pass to Alexander and Carla. Air Center is finalizing, this will be brought to the General Assembly, the strategic plan for the next 4 years or more. No? And the question of Blue One Health is part of the strategic plan. So, the Atlantic Basin will profit from the fact that this will be one of the priorities of work of Air Center. And again, not only of Air Center, but we are dealing with many other multilateral international institutions. But Alexander may bring some, as usual, will enlighten us.
Yeah, I was typing here because perhaps this approach could represent the idea of a program in the ocean decade. And perhaps we could integrate the already existing networks, because we don't have only one network, we have several networks, and then organize some type of movement, joint movement, and propose this as a program at the ocean decade. This could be really, really important, and it is, I think, could be led by a global South country. This would be amazing.
Thank you. Next question is from Joana Soares from their center. What transformative actions on marine biodiversity will benefit the Blue One Health approach?
Carla is the one.
Who wants to address this question?
Carla, you are mute.
She's frozen. I may go and then you complement. I think one of these actions could be divided into planning. So we may have a better way to plan the use of marine environment, including the establishment of marine protected areas. So this will push strongly for the 30 by 30 targets to have at least 30% of marine protected areas by 2030. This is one approach. The other one relates to challenge one of ocean decade, which is understanding and beating pollution. So controlling the hazards, controlling the drivers of marine biodiversity, including marine litter, sewage, and also, for example, improving environmental impact assessment in the subnational level, because this will strongly support this.
I would just add the fact that we are dealing with another dimension, with the communities, agencies, and territorial approach. And I think this brings great awareness of people, which they have this traditional knowledge, but also together with the academy, and to make the right connection between their life, the quality of life, and the questions related to biodiversity. We have many different instances in this, in the Marangatu experience, and I think in another opportunity we could give more details on this.
Thank you. I think Carla is already with us, but let's move to the next question. I think they are for Carla. There's one here from José Motim. I think everyone knows him. He says, Dear Dr. Carla, thank you so much for your comprehensive and informative presentation on the Blue One Health concept. Could you elaborate how this concept complements rather than overlaps with or creates redundancy in relation to other similar initiatives? Additionally, how these concepts can be translated into concrete actions for the benefit of local coastal communities. Carla, can you hear us?
Yes. Thank you, Catarina. Thank you, Moutinho. Well, I think that we need to work together. There are similar approaches that we can use as well, like global health, environmental health, and and if we work together, we are not going to overlap, in my opinion. We may use the One Health tools that are already available, and in my opinion, also
Well, I think she's having problems with
Yeah,
she's frozen. And I don't know if Sander or Paulo, anyone wants to address this question from José Motim?
our results in the One Health approach. Can you hear me?
Yeah, you are back.
Oh, I'm so sorry.
We lost 10 seconds of your answer, 10, 15 seconds.
Okay. I was saying that there are some other holistic approaches that aim at having better results for the health of people and for the environment and for the planet, that we can work together and also take advantage of the networking that people that already exist from the ocean science with the people from One Health, and especially with the joint plan of action that the countries are working on. So if you can include the ocean in the joint plan of action of the countries, I think it's a great opportunity to bring light to the ocean science for better results, and especially working locally for having better results, involving the society in the decisions, and make benefits of it, and also having policies that support our activities and funding.
Do you want, Alexander, Paul, do you want to complement? No. Okay, I think we have many questions. I think we have time for one more. I have one for Mariana, one or two questions for Mariana Martins, also for Carla. Bird flu has killed thousands of seabirds in Brazil in the last 2 years and around the world, as well as pinniped. I'm sorry if I mispronounced the name. In the United States, it has been affecting cows and farmers, causing the deaths of some people as well. The American government, through the company Moderna, is developing a human vaccine for bird flu. How do you see this challenge in Brazil? Thank you.
No, it's a good question. It's very concerning for us. You know that Brazil is a larger animal protein producer. And there are some initiatives in Brazil as well for producing a vaccine, not only for humans, but also for animals. And it's a great example of One Health issue, especially because there is you can clearly see the economic aspects and also the social aspects, because the small farmers are going to be probably more severely affected, so it's also a concern. But in a few words, I think it's very concerning for our country to have many ecosystemic places and issues that we have to work on, and the countries are aware about it, and it's being searched. And I think Brazil is doing a good job, but we have many challenges still to work on. And the vaccine is going to be, it would be very interesting both for the animal health and the human health.
Thank you. We have one question for Alexander. Which software do you employ for monitoring ocean health generally?
Sorry, I didn't hear the beginning.
This question is for Alexander. It's
okay.
Which software do you employ for monitoring ocean health generally?
Yeah, in fact, there is not a software, but we need to have a system of observation and then a way to concentrate the information to deliver products so that we can access. We have some examples for in the case of marine litter, UNEP created the digital platform, which is a big system that integrates information from different countries, from different sources, and this could help us. In fact, what we need is a kind of digital twin of the ocean, which is one of the challenges of the decade, of the ocean decade, so that we can have this type of information organized and being used to support decision making. And this is one of our biggest challenges. In terms of Brazil, there are some initiatives, but we still need to have a vision of the world, which the National Institute of Ocean Research, the INPO, has in its mandate to create.
Thank you. I think you have one more question from Mariana Martins for Carla. Ocean warming and acidification are reducing krill stocks in the Antarctica and may be contributing to seasons of malnutrition among humpback whales and increasing strandings and reproductive difficulties. How Fiocruz Antarctic Projects is acting and studying impacts in Antarctica in the Blue One Health concept? Thank you.
Well, I'm not a part of the FIOANTAR or this initiative. Perhaps Gadeira knows better than me.
Carla, close again.
Paul, can you hear? I think, yeah, okay.
On the animals.
I'm going to move to the last question from José Moutinho. Dear Tour, as usual, fantastic comments. Building on your experience during the Brazilian presidency of G20, how can Blue One Health can harness the implementation of the measures proposed in the Ocean 20 communique?
Yes, I think the main contribution is to provide an integrated view of the processes. I was here with the communique, and when you go through the recommendations, the strategic recommendations, or even the key recommendations we have, we can see that an action alone will not solve the problem. And we need to make them interact with each other so that we can have a systemic change. So the Blue One Health concept will reinforce the need to understand the connection between different things, like wind energy, like maritime transportation, ocean finance, and other things, because without this systemic and this integration, systemic approach and this integration, we will not achieve the goals that we expected in the communique of G20 or Oceans 20, and also SDG 14 or even the Ocean Decade. I think this brings us this concept, and this movement brings us a possibility to think as a whole in an integrated way, and this is powerful.
Thank you. We had a few more questions, but I think we are a little bit over our time. So thank you so much to the participants. Thank you so much for the questions. And a special thank you, of course, to the speakers. Hope to see you soon, and bye. See you soon.
Thank
Ciao,
you.
ciao.
Good
Bye-bye. Thanks a lot.